Welcome to Natural News University, where the experts speak out. Hi everybody, I'm Jonathan Landsman. I'm your host for the Natural News Talk Hour, and I'm here today with Dr. Nicholas Gonzalez in New York City. Dr. Gonzalez treats people with cancer, and I just have one question for you, Dr. Gonzalez. If we could get 1,000 people or more that had cancer or concerned about cancer, and get them all in the room at one time, what would be the single biggest message you'd want to give them?
They don't have to be afraid of cancer. That's the single biggest lesson I would try and teach patients. The most destructive aspect of cancer is fear, because when people are afraid and operate out of panic, they always make bad decisions. So first point, most important point, get rid of the fear of cancer. In our culture, understandably, cancer is a very frightening disease. And when patients are diagnosed with it, they almost invariably lapse into panic and fear, and then they make decisions out of panic. And usually when you make decisions out of panic, whether it's in your personal life or dealing with medicine, it's going to be the wrong decision. So the first thing they need to do is take a deep breath, step back, realize cancer is not a death sentence. It can be reversed. It can be treated successfully. It can be treated successfully non-toxically with nutrition. But they must, whatever decision they're going to make, whatever treatment they're going to choose, the first thing they've got to do is overcome the fear and get rid of it. Otherwise, they're going to make a bad decision, and that will lead to catastrophe.
Right. So then in treating cancer non-toxically, again, most people are taught, you get diagnosed with cancer, surgery to cut out the tumor, the cancerous cells, get it out of the body, chemotherapy, and radiation. And what you're saying is it's not always a necessity. There are other ways, and you're a medical doctor. You have experience. Tell me what that other way could be.
Yeah, I'm trained very conventionally. My fellowship training was in bone marrow transplant, which is about as conventional and aggressive, orthodox cancer treatment as you can get.
Really?
My mentor was president of Sloan Kettering, did the first bone marrow transplant in history. And I do what I do because it works better than what I was trained to do. I do what I do because it's more effective, and it also happens to be wonderfully non-toxic and nutritionally. Turns out that the non-toxic nutritional approach we use, I believe, to be more effective than the most aggressive chemotherapy, radiation, and surgery combined. You can't underestimate the influence of the conventional medical world and the drug companies. Chemotherapy brings in $100 billion a year. There are literally over 1,000 drug company lobbyists in Washington, D.C.
Wow.
They control the media. The National Cancer Institute budget is $6 billion a year, the NIH $38 billion a year, and all of that's going to conventional medicine. Nutritional medicine does not have 1,000 full-time drug company lobbyists in Washington, D.C.
Right.
There's very little opportunity to get the word out. The conventional medical world really controls the media and controls the message. And the message often is misleading, and the idea that nutritional, non-toxic approaches can't possibly work against cancer, any cancer, permeates our entire culture. But it's not correct. It's not based on science. It's based on politics, based on opinion, based on prejudice, based on bias, but it isn't based on science. When I got into this field, I got into nutritional medicine because I reviewed studies going back 100 years showing the particular regimen I use, which is enzyme-based, is effective. And it was a question of objectively, without bias, evaluating the data. What surprised me, because I came out of a conventional research background,
Right.
is that my colleagues weren't interested in evaluating the data. They were more interested in their opinions or their prejudice or their emotions or their philosophies that chemo has to be better or radiation has to be better, rather than looking at the data. I don't care if it's moon dust. If someone can show me the data, I'm perfectly happy to believe it. And that's what science is all about. Science should not be political, it should not be emotional, it should not be philosophic, it should be based on a hardcore evaluation.
Dr. Gonzalez is going to be on the Natural News Talk Hour coming up really soon, and I want to thank you again for all your time.
Well, thank you. Nice to talk to you.
That's great. We'll talk to you soon. Take care, everybody.